myself. I am Dr. Rahul. I am a postdoctoral fellow, Indian Council of Medical Research. Presently, I am a professor, Sandip University, India. And my topic is pattern and outcome dermatological admission in Indian hospitals. So please share my slide and please do the next slide. Please next slide. Please next slide. Yes, my voice is clear. Yes, thank you. The first of all, I will like to introduce the abstract. The dermatology is a primarily an outpatient clinical and surgical super specialty, but the substantial number of patients need in a patient care for adequate management. In recent year, there is a rise in the number of the inpatient dermatological admission. That is a most important issue and increase the spending. Rarely, skin disease can be fatal now. To analyze the disease pattern and clinical outcome of dermatological pattern admitted in a medical wards. Please next slide. In this study involves the retrospective analysis for the admission records of consecutive inpatient with the dermatological diagnosis admitted from the year January 2020 to July 2024. The data obtained were systematically analyzed with emphasis on the patient dermatological profile, clinical diagnosis, final outcome, and duration of the admission. A total number of patients were admitted in this study in our center during this time. Female number and male female ratio is 1:2:2. Infection pattern 53 patient, that is 74%. Inflammatory cases, drug reaction, and cutaneous manifestation of the internal disease had patient 3 is, that is a found 4.4%, and patient was classed as a idiopathic, that is 1.5%. This case is a rare. Please next slide. Introduction. Dermatological disorder are diverse in clinical presentation and severity. Rarely, skin disease can be a fatal, such as malignant melanoma, toxic epidermal necrolysis, and pemphigus, the requiring hospital admission. Therefore, through the dermatology is primarily an outpatient clinical and surgical specialty. It also plays important role in the care of inpatient who are admitted to the dermatological beds and other services. Next slide. Dermatological disorder have a high prevalence now throughout the world and account for about 10% of the outpatient can workload of family and physician in developed countries. In developing countries, data from several studies on the overall community-based prevalence of dermatological disorder indicates that they are also quite common, but ranging from the 20 to 80%. It's a common, and most of them resulting from the infections. Next slide. Material and methods for this study I have used. The study was designed to a retrospective descriptive study. It involves the retrospective review of the records of consecutive inpatient with the dermatological diagnosis admitted in the year January 2020 to July 2024. The wards record were reviewed to gather data on the basis of age, sex, and diagnosis, length of the study, outcome of the admission pattern, number of the dermatological admission, associated comorbidities, and mortality of the dermatological patient. Total number of admission on the wards and number of the death on the wards was analyzed using the special package social software 20. Please next slide. In the result, I found that a total 68 patient was analyzed with dermatological disorder were admitted into the internal medicine ward of the University Hospital, Sandip University. Most patients were from Maharashtra state, with few are coming from the neighboring state. Next slide. Please, next slide. So on the graphical representation and the probability, the frequency of sex determination dermatological cases I have used, the female is the more number than the male. So it is a female patient is more in this study I have used. Graphically representation I have explained here. Please next slide. So in this study, I have found that death percentage are the very low. Death percentage frequency is very low. I have found most of the very severe infection, the dermatological, I found that they are the very less in number, and there is no death. That is more number. It is a dermatological outcome of the patient result, and the dermatographics. Next slide. Dermatographic, the data I have used, there were 47%, 47 is a female, the percentile is 69.1%, and 21%, 21 number is a male, percent is a 30.9%. I have mentioned in the figure, female ratio is 1 is to 2 is to 2 of the age range was 23 to 79 years, with the mean age is a 42.06. That is the mean age of the patient. Next slide. Pattern of disease I have covered. Every dermatological disorder diagnosed was documented and subsequently grouped under the following category. What I found that infection, inflammatory disorder, autoimmune disease, immunobullous disease disorder, drug reaction, cutaneous manifestation of internal disease, and idiopathic disease. Next slide. Infection were seen in infection I have found in 53 patients. That is the percentile is 77.9%. Mostly they are the autoimmune disease, immunobullous disorder in 5 patients I found. That is the percentile is 77.4%. Inflammatory skin disorder were diagnosis in 3 patients only. Percentile is the very low, that is 4.4%. And drug reaction, cutaneous manifestation of internal disease were also seen in 3 patients. Each of the percentile is the 4.4%. In one patient, there is a 1.5% diagnosis was not indicated, and it has not found the any disease that has grouped as it is a idiopathic condition. Next slide. So the specific diagnosis for dermatological disorder seen were oropharyngeal candidiasis, herpes zoster, herpes simplex virus, chickenpox, genital warts, tinea corporis, candida integrito, cellulitis of lower limbs, Steven-Johnson syndrome, Kaposi sarcoma, pleuritic papular eruptions, bullous pemphigoids, systemic lupus is found more, erythromatosis, exofoliative dermatitis, pruritus, apoptic dermatitis cases has been found. Next slide. I have also seen retroviral diseases, that is a 58.8%. Some patient had no association to comorbidities, 17.6%. Diabetes mellitus patient seen 8.8%. Renal impairment 2.9%. Weight 2.8% of the patient having associated with the malignancy and pneumonia. The least comorbidities reported in 1.5 patient were septicemia, congestive cardiac failure, hypertensive, and cerebrovascular diseases. Next slide. Please, next slide. Mortality was recorded in 32.2%. I have found in the 9 patient of dermatological inpatient admission, while 86.8%, that is a patient count is 59 patient number were discharged. The cause of death in all 9 patients were due to the dermatological disorder group as an infection. 8 of the patient had died had retroviral disease as a comorbidity, and 1 patient diagnosed with coexisting cardiovascular disease. Disease associated with mortality were oropharyngeal candidiasis, Kaposi sarcoma, and Candida intertrigo. Next slide. Please, next slide. Discussion in this study, dermatologic in patient from our new of the 6-year sparing journey, that is January 2020 to the July 2024, revealed only 68 patients with female, male counting for 69.1% and 39% respectively, age ranging from 23 to 79 years. The low count of patient in a part is attributable to industrial action embarked upon by allied health worker interfering with the smooth run of patient care activity in the facility. However, dermatology basically is an outpatient care discipline in the major parts of this operation, except in cases of the comorbidities like advanced stage of retroviral disease. Next slide. Please, next slide. There was a female predominant in our study accounting for 69.1%. This is due to concern for the cosmetics by women, generally the health-seeking behavior, and women are found to easily evoke assistance from relatives in aiding their care when seeking health care compared to their outpatient in our environment. Next slide, please. Conclusion in this study, dermatologic patient is mainly an outpatient case discipline, but where needed patients are admitted to optimum care. In our study, in the similar study, women seek dermatologic care mostly for cosmetic reason. Infection cause of the dermatological condition still record high, and mortality is mostly associated with the advanced stage of the comorbidities like retroviral disease. Next slide. Acknowledgement. I would like to express my profound gratitude to highly respected, world-renowned scientist, Dr. Ramesh Paranjape, esteemed laboratory scientist and retired director, National AIDS Research Institute, Pune. Being a great knowledge source for this work, I seek continuous support for my research work. Next slide. Please, next slide. Thank you. Thank you for listening my short presentation. If you have any question, please ask to me.